Hi, this is Roger Smith from the True Blue Media, and today I have a 1987 grad, a Mr. Michael Brooks, who is a urologist. And I'm going to take the time to ask Michael all the questions that all of you want to know. One of the greatest things is doing this platform. I really need you guys to subscribe, like, comment, and send it to a friend. So, without further ado, here's Michael. Michael, good evening, sir.
Hey Roger, thanks for having me, man. I appreciate the opportunity to talk on some stuff that a lot of times we don't get a chance to talk about
Uh-huh.
because obviously men are not great at expressing,
Themselves.
their opinions. Yes, so
Right.
yeah, I
Yeah.
appreciate it.
Good, good, good. So, Michael, let me ask you something. You being an 87 grad of Manning School in Westmoreland, did that shape in any way what you've become?
Um, I mean, I think so. Being a countryman is always a little different. You see a lot of things that you're, um, more um, the guys from the corporate era will not see. You come from a background where you probably see a bit more of bit more poverty, sort of basic lifestyles. So I think that has shaped how I practice and how I treat patients to a large degree. I think so. I'm, I mean, Manning's has produced a lot of great people. I can't claim to be one of them, but um, certainly I'm always proud to say that I'm a Manning's alum because I think it's a great institution.
Nice.
Um, yeah.
Nice, nice, nice. So before I get into my questions or my line of questioning, can you just give us a small, a little, just walk us through your journey from Mannings to where you are today, sir?
Well, yeah. So I mean, coming out of Manning's, I actually had no idea what I wanted to do. I wasn't a particularly great student, meaning I didn't apply myself and perhaps um, underperformed as I think my teachers, my A level teachers, would have been a little disappointed in me. But I wasn't somebody who applied myself early in my student life. Um,
But Michael,
so
you say that. Is it really important? Isn't it important that you get to where you need to get to, and where we peak and where we mature? It's all part of the journey. Some.
yeah, it's actually one of my pet peeves because it's one of my great criticisms of the common entrance exam system, or what they call it PEP now, or yeah,
Mhm.
is that it relegates students who don't do well at that level to sort of lesser schools with lower standards, and I think it does a disservice to the youngsters who just haven't reached a level of maturity or acquired the necessary focus to sort of do well academically at that stage. Doesn't
Understand.
mean they won't get there, but I think we've done a great disservice to a large many youngsters who didn't do well. I mean, I think they tried to address it by sort of rebranding secondary schools as high schools, but they haven't really done any upgrade of the basic infrastructure and the necessary staffing to make
Right.
these schools, achieve higher educational standards. So it's one of my pet peeves, and I think this directly correlates with the lack of the development of our people resource. You see a lot of advances um, technologically in Jamaica. You see all of the highways and the flyovers and the nice cars. But I do believe we're going backward with people development and skills training. I don't think we're doing what we need to do.
I agree. I
Um,
agree.
but
So,
that, yeah,
so I want to know after after 87, you
yeah.
must have been a fairly good student for them to call you back to
But
sixth form because I heard that wasn't a must. Go ahead, sir.
yeah, no, no. I mean, I did well at CXE O level standard. And I passed my A levels, but the truth is, my grades weren't great, and I think it's because I kind of didn't know what direction I wanted to go, didn't know what I wanted to do. So I ended up in natural sciences at the University of the West Indies, trying to figure out what I was going to do. And at some point, I said, okay, by a process of elimination, I'm going to do medicine. So at that point, I needed to impress my tutors and get some good grades, and that's what I did. And then I was able to transfer to medical school after a couple years. So
So,
I,
what country, what part of the country did you come from?
well, I was in Westmoreland.
No, no, yeah, sorry, I know that. What part of, Grange?
Oh no, so I don't know. There might be some people in Westmoreland that don't even know the bush that I'm from. But I'm from a little place called Delftland, Westmoreland.
I've heard of Delphi, I don't know where it is. So walk us when you're going home from school. How do you go home and tell us the road and who's listening
Right.
will know?
So if you could either take a Little London bus. So if
Okay.
you could take a bus going to Negril
Uh huh.
and you get off at Little London,
Okay.
and then there's a road going north that leads you to through to Delftland,
Uh
which
huh.
which a lot of people refer to as Mango City.
Okay. So Orange Hill isn't that is Orange Hill nowhere near that?
Orange Hill is further on,
Okay.
closer to Sheffield, Negril
Right.
area.
Understand. Understand. All right. Hey, hey, you have to put you have to put Delphi on the map. Or you can't skip over
Yeah.
that. All right. Good. Good.
Delftland, yeah, yeah.
Continue, sir.
Front of Delftland. Yeah. Where were we? I was saying,
Yeah, fifth. You're going from fifth form. You're going to sixth form. Go ahead.
all right. So I
And you
was
done the natural sciences.
natural sciences. So I transferred into medical school in 1992, um, and graduated in 97. Um, when I graduated, I knew I wanted to do something surgical, and sort of fell in love with urology along the way when I did my rotations in um, in my postgraduate surgery training. So um, urology training was prolonged because I started the program in 2000 and I finished in at the end of 2007. 2 of those years, though, I spent in the UK getting some training there, and then I went back and finished up. So I practiced at KPH for 18 years
Okay.
in total, and then I was recruited to Bermuda in 2018 and have been here since. So the practice is quite different here, but when it comes down to it, it's similar. You're treating human beings, and they kind of respond the same way to to medical care and to how you interact with them. Um, so the basics of it are similar. There are a few little nuances that are make a bit a different environment, really, but the interaction is pretty similar.
Okay, so why urology? That's a question. And why surgical? What were you growing up and cutting that you thought that urology is where you wanted to go? The cutting,
Well,
you know.
to be honest, growing up, I don't think I imagined or dreamt of being a physician. I think what happens to a lot of youngsters in the Caribbean, at least, maybe 15, 20 years ago, is that you get sort of pigeonholed into sciences or the arts. And then if you're reasonably bright, you get sort of pushed into law or medicine, which again I have a huge issue with. There are a few more opportunities nowadays, but back when I trained, most of the people who did well were either sort of shunted into law or medicine, which I don't think makes any sense, and kind of speaks to a lack of uh, sort of overarching vision from the leaders. But it is what it is. I don't regret it. I've loved medicine. I do, there are aspects of it that I could do without.
Right, right.
Um,
Back now. You're back now. Okay, you're back.
right, right.
All right.
So, I was just saying that at the end of medical school, at the end of my natural sciences sort of tenure, I didn't, I sort of selected medicine as a process by a process of elimination, really. That's what I chose what I just um, removed what I didn't want to do, and I was left with medicine.
Okay.
And then at the end of medical school, rotating through the specialties, I did fall in love with surgery. I knew I liked to you know, do things with my hand, and urology in specifically offered a good combination of um, what are we, call open surgical techniques and the more minimally invasive or endoscopic or laparoscopic procedures, which we do
Before
about.
you go on, Michael, could you define what
Right,
urology
that's
is and what the studies? Because guess what? I'm just remembering in my mind. I'm thinking, yeah, I know what it is, but do I know? And I'm wondering if everybody else knows. So sorry. Go ahead.
right. So what a urologist is a specialist surgeon who treats conditions of the male and female urinary tract, so the kidneys, the bladder, the prostate, and also of the male genitalia. So um, we treat things like kidney tumors, prostate cancer, kidney stones. Um, if you have blood in the urine, then we're the ones you would speak to most for the most part. Um, so we are not only male doctors, which a lot of people get confused about. We do treat quite a few females because kidney stones and bladder issues are very common in both genders.
Okay.
Um, so yeah, so there's a wide range of things, and some of the things we treat are very common. So um, prostate enlargement, prostate cancer, extremely common conditions, and kidney stones affects at least 10% of people during their lifetime, which is a lot.
So when you think of prostate cancer in your experience, what are the typical early signs that you see?
Right. So one of the things we like to hammer down is that we don't want people to get the impression that you will look out for signs for prostate cancer. Because early prostate cancer has no symptoms, has no signs. So this is why we advocate screening for prostate cancer. Um, and by that we mean a blood test and and a physical exam, which involves a digital rectal exam, which a lot of men tend to shy away from. Uh,
This is why this is why this podcast is beautiful. You see, when you use the word digital, what you say again?
Rectal.
Yeah, you see, there's people know, they want to know there's a finger being inserted in their ass,
Exactly
But
what
when
that
you say
means.
it the way you do it,
Sounds like
that's why a lot of people not coming in the in the doctor account. I use them words there and they don't know what they signed up for. So go
yeah.
ahead.
So I mean, a lot of people seem to be afraid of this rectal exam, but unless you have a painful anal or rectal condition, it's a painless procedure. Obviously, nobody wants somebody else's finger up their bum. Uh, I mean, maybe we can that. But let me press on. Um, but it's a very quick exam, gives you relevant information in a short period of time. Um, but a lot of people a lot of men seem to be, you know, against the examination. I've had a lot of patients who refuse to have it. I don't really force the issue. The blood test is not a replacement for the examination, but it gives you, in most cases, enough information to work with.
And that's
Um,
with the PSA test
yes, it
specifically.
is.
Yeah, yeah. Yeah.
Right.
Michael, I interviewed a young man yesterday. I think he was 39 years old. And what I wanted to do was incorporate a question. Do you know what a PSA test is? Because, when you start telling a man, you must go and get yourself checked. For some men, they feel a lot of pressure. I don't know why. They feel a lot of pressure. What do you think's behind that?
Well, my observation is that men are very skilled at burying their heads in the sand and just sort of assuming that everything is okay once they feel okay, which is obviously a fallacy. But I think most men are sort of afraid of their own mortality and don't want to confront it head on. And it does not serve them well in a lot of cases because the truth is prostate cancer is extremely treatable and curable when caught early, but can be lethal when you leave it till too late. Um, there's also the notion that once you go messing around with cancer, you cause it to spread, which is not true.
Right, right,
But
right.
there's a lot of little myths and old wives' tales. But
What's a common misconception about urological health?
well, one of the things that I think I found is that once I mention the word prostate to men, they assume I'm saying they have prostate cancer. Um, that's one. I do try to point out to them that even young men can get prostate issues. It doesn't have to be cancerous. In fact, it's more commonly an enlarged prostate than prostate cancer. When
And
you
what would
get
just
to
cause an enlarged prostate, typically?
right, you're asking a very big question here, which I don't know that anybody knows for sure. There are
Okay.
certain theories, and there are certain things that we know that promote prostate growth in terms of your diet and lifestyle. But certainly, you know, we know that, for instance, if your father had a big prostate, it's likely that you will have a big prostate. So there's heredity that plays some role. But we do think like the Western style diet does have some impact on your risk of prostate enlargement and prostate cancer. So, high meat and dairy intake, fried foods, fatty foods, high sugar intake, are all things we think have some sort of effect on your risk for prostate enlargement and prostate cancer.
Those foods you mentioned looks like they can kill you anyway because they
Well,
tick a lot of other boxes as well, you know.
they do, they do.
So if you wanted, good urinary health and lifestyles, what sort of foods would you be eating? Give me some. If I wanted to have really, good bladder strength, sometimes you stand up beside someone at the urinal, and when them a pee pee it coming like it's coming from a horse, and you're dribbling, and you think, hey, what's wrong with me? Why can't my piss gush like that? You know what I mean? What sort of
Right.
things can we do to improve our urinary health and bladder control?
Well, all right. So let me just address that. Probably not in order, but the urinary flow is often not um, an indicator of your bladder strength. It's more often an indicator that there may be something obstructing the flow, such as your prostate. So if you notice you have a slow flow, then you should get that checked. Now you can have a weak bladder, but that often is a byproduct of some other underlying disease, such as diabetes or some sort of neurological disorder. But in general, a slow flow is not necessarily an indicator of your bladder strength. Um, if we're talking about prostate healthy diets, you're talking about diets rich in fruits and veggies, green leafy vegetables. Tomatoes are supposed to be really good for your prostate. Green tea, rich in antioxidants, right? So avoidance of lots of red meat, sticking to mostly fish.
Rasta
Um,
diet, you talk about Rasta diet.
yeah, so those things tend to help. Now there are a host of other things that people say are beneficial, but haven't been studied properly. I know that lots of Jamaicans swear by soursop leaf and pumpkin seed and all of that sort of thing. But some of these things are being studied, but the truth is those kind of investigations aren't mature enough for us to draw conclusions.
What sort of?
So
Sorry, go ahead.
right, so I mean, in general, a prostate healthy diet is one that we would probably prescribe for cardiovascular health. So maintain good heart health. So the majority of those, sort of measures you put in place for your cardiac and cardiovascular well-being are the same ones you'd recommend for the prostate health.
What
Um,
are what are common causes of urinary incontinence for the layman? Men and
right.
women, men and women. This is yeah.
So the vast majority of patients who develop urinary incontinence, and there are different types, right? But the vast majority are probably related to an overactive bladder, where you get the urge to pee very often, and when you do get an urge, you have to rush. A lot of those symptoms can actually be a byproduct of prostate enlargement as well. But overactive bladder also affects a lot of women. Um, so they tend to get inadvertent leakage, which is what urinary incontinence is, when they can't make it to the bathroom in time.
Right, right,
So
right.
we call an urge incontinence, right? Um, and then there are other types of leakages which happen with cough or sneeze, which is called stress. So that when the bladder comes under some amount of pressure or stress, you get a leakage. So that can be due to a bit of pelvic floor muscle weakness or damage to the pelvic floor muscles or damage to the intrinsic muscles that line the urinary passage, so we call the sphincter, which can happen in surgery or childbirth. Um, and for men, they tend to get that sort of leakage often after prostate cancer surgery. Um, so, there are different types of leakage. There are some people who will obviously who've had a stroke may not have conscious control of their urination because of um,
Nerve
cognitive issues.
damage as well.
Right. And then, spinal cord injured patients. One of the, um, it can also be a byproduct of long-standing diabetes, obviously, which has a lot of, um, effects on many organ systems, but also importantly, the nervous system. Right.
How
So,
does stress come into this?
you mean like mental stress?
Yeah, if you're really stressed, does that have anything to do with your, you know,
I,
so say for
I,
go ahead. Like sleep, if you get to sleep a lot and you look after yourself, indulge yourself, or if you're a warrior, does that have anything to do with your urinary health, or it's not it doesn't matter?
I wouldn't say it doesn't matter. I don't know that it's a major contributor, but we do know that you may if somebody has an overactive bladder, times of when they're anxious, they may pee more often, right? So that may happen. But in terms of being like a causative factor, I don't know that that really happens. Um, but it's
So Michael, let me ask you this. So when someone comes to the urology center, how does a guy like you make a man comfortable to be able to take his penis out and tell you, my testicles are hurting me, it's burning or whatever? What is it about you that makes this man comfortable? Because
I,
it's not easy. And I'm asking a question where a lot of people are asked.
I would like to pretend that I do something to make them comfortable. But the vast majority of most men, when they come to the physician for those things, most of them are expecting to do that. Obviously, your bedside manner has a role to play. Some men, don't want, obviously may not respond to members of the opposite sex or may not open up in that scenario. But I've also had men who say they prefer to see a female physician. Um, so, I think it often depends on the patient's personality. I also make it clear that, they don't need to do anything that they're not comfortable with. But honestly, I can't necessarily take credit for, um, you know, their willingness to cooperate with the examination. I think the vast majority of patients are okay once they come to the physician. They want to be helped
Right,
and
right,
are
right.
what it takes to sort of facilitate that.
I think I think personally, when I go and see my urologist, I have to think in my mind. I've got all these things in my mind, and I'm thinking, gosh, what a job this guy has. He's seen, 15, 20 penises a day or whatever the case may be. I'm just thinking in my mind, and I'm like, what kind of job is this? You know what I mean? But do you realize, do you ever stop to think that we are the only species that worry about these things? you know, and I don't look at us. We're a little bit smarter than most animals, but I don't think we're
Right.
that different. But you think about it, we're the only species that worries about our penis
Yeah.
size and all sort of stuff.
What we look like. Yeah. Well, I mean, self awareness apparently, is a kind of double edged sword.
Hmm.
On one hand, it helps us to sort of navigate the world, but on the other hand, it does create these unnecessary barriers. Um, so I understand, you know, that as a species, we do have some um, unproductive traits,
Hmm.
but they're a byproduct of being sentient and self-aware.
Let me ask you.
I have a question for you.
Yeah, yeah, yeah.
So if you go to your urologist, if you see them on the street, casually, one day on a weekend, is it awkward for you, or are do you feel that that's not a scenario you want to interact with them in, or if,
Michael, my name is Roger Smith. I ask the difficult questions. I don't care where I am. If me and you in a barber shop, me say, I will talk about these things. And I got a joke for you. With my circle of friends that I have in Texas, at our age, at 59, 60, I'll be with a friend, or the wives may be all around, and it's not weird to hear one friend say to another, "Yo, you have any helpers me run out?" And they're talking about either Viagra or Cialis or whatever.
yeah,
I remember mentioning this to one of my Jamaican friends, yeah, of my age. Him
yeah,
said, no, sir, me no need these things, me no need them the things, me no need that the kind of help. And I was thinking to myself, that level of defense worried me, if you
yeah,
understand what I mean. And
yeah,
then I'm gonna be the guy that's gonna talk about it. I'm gonna say, these guys, and it's normally Jamaicans in Jamaica, not in the diaspora. I don't find these,
right,
and don't get me wrong, we're no different because you're out as well.
right,
But Jamaicans in Jamaica talk about their erections like they were in third and fourth form. Yeah,
yeah,
like when teacher asks you to stand up and answer a question you can't because you have an erection, they
yeah.
act like that. And I'm thinking, so I'm wondering, is something wrong with me or are they lying? That me want to know. Tell me,
Most of them
doctor.
are lying. That's my opinion. Most of them are lying.
Yes, I believe
Um,
that. Yeah.
yeah. We all are subject to the ravages of time, and it's true. You just don't have the same quality of erections when you're older as when you're young. Now, some men are blessed, but that is the minority.
When you say blessed, you mean blessed with the ability at 50 and 60 to stand up strong like
Yeah,
a green planting or a ripe.
they're
Okay.
no green plant, and these are outliers. But
Give me a percentage. Boy, the
I
fact
know.
that
I don't think that has been something that's been studied. But
okay,
I'm convinced that there are men like that just from having discussions with some of my patients.
remember say they lie, a lot of
Yeah,
them do
but
lie.
I don't think all of them lie all the time. All of them lie sometimes.
Yeah, and there's another misconception I'd like you to help me with. Everybody talking about you can't take Viagra. What will it do to your heart? All these things it will do to you. It will kill you. Can you tell me? You know, all right, I'm going to give you my layman what I think is going on. I think that a lot of men take Viagra, and if they don't, one, if you're not fit and your diet isn't good, that's number one. Number two, if you're expecting it to work very quickly, read the instructions properly, You may even end up take two because you may be stepping out on your significant other and you may have a small window to do some work in. And you may take two. And guess what? That'll have double the effect. And maybe you're not supposed to have 1,000 milligrams of Viagra in you. But tell me, sir.
Right. So with Viagra, there are a few issues. Um, I can say that vast majority of physicians will prescribe Viagra responsibly. Um, Viagra is a safe drug, but there are certain conditions and scenarios in which you should not be using it. So if you are, have cardiac conditions which preclude exertion or, physical exertion, you should not be taking. If you're on certain types of medications that are called nitrates, which are for a certain heart condition, you should not be taking Viagra because Viagra will then cause a dangerous drop in your blood pressure, which can be fatal and has been. I think the vast majority of people who have died after taking Viagra are not taking it by prescription because it's now widely available on the black market. There are a lot of the things that are sold on the black market with, other names, the boom, whatever it is. They combine a lot of different things, which sometimes includes Viagra. So if you're taking Viagra without, you know, a, a prescribing physicians having recommended it, then you're putting yourself in danger for having a bad outcome. So I think sometimes that's the problem. I would think that actually most of the times people end up with having fatality from taking Viagra. That's the situation.
Should they use Cialis instead?
No, because it's the same. It's the same class of drug,
Okay, okay.
so it has the same potential for causing that problem.
So steamed fish, Guinness punch, and okra does nothing.
Not to my knowledge,
Peanut
but
porridge neither.
no, I don't believe that these things do anything. So if you can show me there's some science behind it, but based on my knowledge of what's in these supplements and foods, there's nothing there that would make me think that it increases your ability to sustain and maintain an erection. Now, there are lots of things that they have sell on the black market which certainly do that, but steamed fish and okra and peanut punch, nah.
Okay, okay.
Right.
Irish moss and all them thing there. Yeah, yeah, yeah. Right.
Um, yeah, I don't think those things work.
You know, it was
But
funny.
the
Sorry.
mind is a powerful thing. The mind is a powerful thing. You you probably heard of the placebo effect. So
Yes.
there are a lot of times when your belief that this thing is going to work, it actually manifests in a positive result.
And,
The erection is a funny thing because it's not only you don't only get a successful erection from physical contact. There's also the mental aspect to it.
so
So
when you study urology, do they go into the psyche? And I have some questions to ask you about that. In that, the first one I wanted to ask you, when I say the psyche, I mean, is there a link with the mind and this bladder control and whatever? Because you'll notice some people can hold their bladder for ages, and they'll go straight to the toilet, and that's when their body will just release, and that's when they'll soil themselves. But they've been in a vehicle for 2 hours holding it, but they just get to the toilet door, just coincidentally, and that happens. Or another thing is you may have thoughts in your mind that may help you get an erection. That's why some men watch porn and all that sort of stuff. So I'm wondering, is there a link in your brain to parts of
Yeah,
your
for
anatomy?
sure, for sure, for sure. And you know, the you can consciously hold your urine. And people may have varying abilities. And this is how children develop bladder control. You know, they start out with automatic bladder emptying, right? So the bladder is full, there's a reflex that occurs in your spinal cord, and the bladder starts pushing. But as you get older, the nerve connections develop, and the ability to consciously control the bladder also becomes mature. Now, some people lose that when they get older. That can either be due to a disease process, or I mentioned the term overactive bladder. And vast majority of the times, we have no idea why somebody develops overactive bladder, right? But what happens is that the bladder becomes a little less responsive to your psychic or conscious control. Uh, but certainly there are pathways from your bladder through your spinal cord and through your brain to your brain that help, or function to control bladder emptying, right? So the, with the erections, um, it may be a little more complicated because your level of stress, anxiety, interpersonal relationships, your mood affects that. If you're depressed, you're less likely to get erections. um, but that may all tie into um, hormone production, because testosterone production um, occurs because of secretion of a hormone, another hormone from the brain, right? So all of that may be tied in. Um, so we know that for sure, your emotional and psychological state affects your ability to have satisfying erections. Um, we know that if you're not sleeping well, if you're not getting good sleep, um, then that's also a problem. One of the big problems with people who have erectile dysfunction is it becomes a vicious cycle, right? Because they get a bit of performance anxiety. That anxiety worsens the quality of the erection, right? So it becomes a vicious cycle in which there's a genuine problem of a bad of poor erectile function, but it becomes worsened by their stress about the situation, and then the erection becomes worse, the anxiety levels become more heightened. And this is why it's very important to have a partner who is involved
Understanding.
not all the way. But it becomes a problem when you're a man who has casual relationships, because this is not something you can discuss.
Dr. Brooks, you use the
Yeah.
word casual relationships. Are you saying Jamaican men may cheat? Come on,
Oh, for sure.
black men don't cheat. Okay, so
Um,
casual. I think it's important that women, especially if you're married or in a committed relationship, unless you're willing to talk about the issue with your wife or your girlfriend, or I think you're on a loser because it's just going to
yeah,
wind you up, and you're going to be the one that's going to suffer in the end.
exactly. And I encourage men to do that all the time, to involve their partners, and a lot of them are very reluctant to do that.
Did you know in the
because
seventies, around about, I'm going to say 72, and probably I went back to England in the 80s. When I remember even being on watching television and just being around older men, and there was this thing about them being miserable, and I wonder, were a lot of them just not getting, but don't worry about your grandfather, he's just miserable. You keep on hearing these things. And then you'll see it, they'll categorize an old man as being grumpy. And I'm wondering, is it because of the lack of erections back then that was causing this
quite,
grumpiness? You
quite
know what I mean?
possible.
Because granddads now are happy, they got the little blue pill. You're getting people, you're getting 85-year-old people dying in Jamaica, and I know this for a fact.
Yeah.
An old man dies and he's got condoms in his pocket and Viagra, and a man in a mid 80s, and you're thinking, good Lord, this man wants to go away happy. So it's amazing, and it's nice at this age you can still feel
Oh yeah,
virile.
because the we are built very differently from women. I'm not saying women don't have desires in their advanced years, but it does tend to wane in women, right? The sex drive.
Right.
In men, vast majority of men, that sex drive remains, right?
Sometimes
That
just in the mind, though.
right, but the ability
Yeah.
to perform is what the problem is,
Yeah.
and so it must be a great source of frustration for a lot of men that you still have this desire and the drive, because you will have the drive mentally once you have testosterone, right?
So what's happening to the nerves in the penile shaft that is not allowing it to get erect? What's happening in
Well,
the man?
the vast majority of people who develop erectile dysfunction it's not a nerve issue, it's a blood flow issue,
Okay.
and it's almost very often a consequence of chronic medical illnesses or lifestyle choices. So if you've smoked, if you've had high blood pressure for a long time, or diabetes and high cholesterol, and you don't exercise, you're obese, those are all things that negatively affect your ability to maintain erections into your advanced years.
Okay.
There's a small proportion of men, small but significant, who also develop waning testosterone levels. So their testosterone may fall. And I do try to make sure when I see men with erectile dysfunction that they do get a baseline testosterone. Because, and I do try to impress on them that testosterone is not just important for erectile function, but it's an extremely important hormone for maintaining your muscle mass. It maintains your level of alertness, mental um, quickness. It also affects your mood. So if your testosterone is low, you may have a depressed mood and your more level of motivation to exercise and do things, get out of bed. So if you find that that is happening, um, and your erections are poor and your desire for sex is gone, then those are some symptoms of low testosterone. The other important function that testosterone plays is in cardiovascular health, because it also has an effect on cholesterol um, levels in your blood. And if your cholesterol levels are high, then you're prone to develop cardiac issues as well. So it's an extremely important hormone. Um, it ties in also with something I like to stress, which is maintaining, in men especially, maintaining muscle mass and mobility as you age. And I think most men don't pay enough attention to that. That it's important to exercise, but exercise with a view to maintaining. You don't need to try and get bulked up, like, on steroids, but doing a bit of resistance training.
Yep. It's funny.
Right?
It's funny. It's funny you say that because when I'm on these conference calls at work and stuff, I have a little, weight that
Right.
I keep because sometimes you're in the office for hours and you have to
Just
do
sitting
something.
on.
Yeah. And what I
Yeah.
try and do is I drink a lot of water so I can go and pee because
Right.
you have to get up. So
Exactly.
when you have the full prostate removal, say for example you're 60, 65 years old, apparently they have this nice hydraulic pump that they can put into the penis shaft, and they have a nice valve they put in the testicles that when your significant other wants to play, she can pump you up, and it has a nice little release valve at the end, and you can, and I don't know if you've heard of those things. What do you think of them?
Right. So you're referring to a penile prosthesis. It's used also in other scenarios apart from post surgery. Um, they're great. They're great. There are other forms of penile prosthesis. What you're referring to is an inflatable, but there's a simpler one called the semi-rigid, which sort of it only comes. So what you described was a three component sort of device, which has the cylinders that go in the penis. It has the switch thing which you activate to inflate and deflate, but also there's a reservoir that holds the fluid that fills up the penis, right? So that's a three component device, which is, I would say is the gold standard sort of treatment if you're going to get a penile prosthesis. Um, but there's a simpler one called a semi rigid, which is made from a material that is basically always in a semi erect state, which you can bend and straighten. So basically, you just straighten it out for intercourse. When you're done, you bend it so it fits into your underwear. So
A
it's always in
collapsible penis. Collapsible penis. It's beautiful.
there. So there's that
Nice.
device. But both devices have a role to play in men who have erectile dysfunction but don't respond to any of the other treatments,
Drugs.
which, yeah, medication. But before you get to the penile prosthesis, there are other things we try. Okay, so we may try a little pellet down the urine passage that gets absorbed into the penis. Um, so there's a drug in it that opens up the channels in the penis to give an erection. Um, what a more effective way of delivering that drug though is by directly injecting it into the penis. So we sometimes teach men to give themselves these injections. The problem with that is that you have to inject yourself each time you want to have sex. Now it's a small needle, but if you want to be very active, then the injection is a little bit of an impediment, right?
I
Um,
think I think nothing would be worth that. An injection? No, hell no.
there are several of my patients that do it,
Wow.
and it's very effective. Um, the other treatment I should mention is the vacuum erection device, which is sort of I don't know if you've heard of it. It's a cylinder that you place over the penis, and there's a little pump that is attached that sucks away the air around the penis. And if you know a little bit about physics, you know that nature abhors a vacuum, so blood sort of rushes into the penis. You get an erection. Now, to maintain the erection, you do have to put a rubber ring at the base of the penis. So
Okay.
a cock ring, basically,
Okay.
which lots of men apparently do, even if they get normal erections.
Right, right, right.
Um, so you can only have that thing on for about half an hour because the penis, you're not getting any blood flow, active blood flow, and the penis does require at least some blood.
Right, right,
Um,
right.
so you have to take that off after half an hour to
I think half an hour is long enough, especially at our age. you know,
uh,
um, go ahead. Sorry, sorry.
yeah. I probably should mention that you mentioned the people who've had surgery for their prostate. So one of the things I want to hammer home is that not everybody who has the surgery will have erectile dysfunction. Now, granted, it is a common um, complication. You know, probably 50-50, maybe 40%, 40 to 50% will get erectile dysfunction. Um, but and this is why a lot of men will shy away from it. Um, but the type of erectile dysfunction you get can also be due to nerve damage, and this is a scenario in which the nerve damage you mentioned may be relevant. Yeah.
Another question I want to ask you is, what's with the testicle size as you get older? It looks like you stand up in a toilet and it's still left in the toilet. What's going on
Yeah,
with that as you get older?
I know I've never really looked at a medical um,
But you know what I'm talking about, don't you?
patient for that. Yeah, but
Yeah.
I think it's just um, gravity as you get older. The effect of gravity, and then your skin also is looser, loses tone, so you do get a little stretching and elongation. But
Because when you're younger, they're tucked up right beside the soldier, and
yeah,
as you get older, they don't want no part of him. You know what I mean?
exactly.
Yeah. Wow, wow,
Yeah,
wow.
well, we're gonna call it a win. It's an increase in the size of your genitals. I don't know.
Okay. That's true. That's true. And another thing I notice as well is when you're in a warm, nice, warm, humid climate, especially you go Jamaica and all them places, you get a little bit more girth and a little bit more length. Why is that compared to someone living in Canada or
Right, right.
England?
So in cold weather, your blood vessels tend to constrict a little bit, and that's the reason the vessels are a little constricted to maintain your. So if your blood vessels were just to open, you'd lose a lot of body heat in
Right.
the
Okay.
cold. So the response of your body to cold is to shut down the blood vessels in the periphery so that you maintain your core temperature. So you don't lose your body heat when your vessels are just open and your if you have a lot of blood flow to your skin when it's cold, you're gonna lose your ability to maintain your core temperature. And obviously, your bodily functions require an optimal core temperature. If you lose that, then you go hypothermic, right? So it's a natural response to cold wear, and you'll find also that your testicles, yeah, like as you described, get a bit closer to the soldier because there's a response. The muscles tend to you have muscles in the skin of the scrotum which get a little tight when it's cold.
A couple of my friends have had the snip. I don't know why they would do that to themselves, but they've had the snip.
I
Does that?
I
Go ahead.
I 100% advocate the snip as the better option to the female version of the snip because it's such a simple and relatively painless procedure.
But all of them are trying to turn it back. They get a new partner and they want to come back to
You
our
see,
side of it.
they didn't. I'm not sure if they didn't receive the proper counseling or they didn't think it through. But
When you're
that
wait, when you're in a bad relationship, you see when you're in a really bad relationship and you get one,
You
And you
don't want
said to
to.
yourself, sometimes some of these men don't even tell the ladies, them say, you know something, let me just call a doctor, go get this nip because this now going to happen to me again, you know? So,
Ethically, that's wrong. They should at least inform their partner. But yeah, I mean,
it's not
I
illegal
think
though, is it?
I don't think so.
Okay, so it's all right then. What should have known now go hurt her, you know? Yeah,
Yeah,
yeah, yeah. Are you
but
religious, Michael?
I am not.
Okay. Hey, I won't judge you for it because
Yeah,
I think we
I
may.
am not. I respect religious people though. I don't have any issues with people's religions. I don't consider them any less intelligent. They're probably vastly more intelligent than I am.
No, no, no. I
But
understand.
but
It's a
I
personal thing.
it's a personal thing.
So, growing up in Jamaica, growing up going to church, I don't even have to ask if you went to
Oh
church.
yes, of
I could just
course.
look at you and tell. I know that you
Yeah,
know Bible verse because that's how we were brought up. I went to church, 4 or 5 times a week. People say, "Boy, I saw you lie," but I lived in a
yeah.
little place called Piper's Corner near Amity, and I went to New Testament Church of God in Piper's Corner. And I remember we had FDH on a Monday, family training hour.
Yeah.
Wednesday was a Bible study. Friday was like a youth thing where we're gonna
Right.
sing and lick drum and then Sunday we're going in the morning and Sunday we're going in the evening. That's 5 times a week. I mean, how could I not be a Christian? But as
Right.
I got older, I got to look at things a little bit differently, and I have so many unanswered questions, and I think the the proving of the pudding is on the other side. So that's my
Right.
views.
It's I perfectly accept that I could be wrong.
Oh, me too, me too.
Yeah. But I just I'm somebody that needs evidence, and I don't know if I've seen it, and I think that's just my issue. Um.
Does anyone ever judge you for not being of faith?
Oh yeah, I'm sure they do. It's not something I openly talk about. If I'm asked a direct question, I'll answer it, but
Oh,
I don't volunteer that because you come from Jamaica and then you tell people you're not religious, you're not a Christian, and boy, it's like you're the worst person on earth.
oh well, I've been
Right?
living. I've been that guy. I am that guy. I am that
Yeah,
guy. But that's because I like arguing and laughing. So I'm always
right.
gonna be the provocateur. So if you say up, I'm gonna say down.
So I'm convinced of certain things that in terms of religion. What I what I struggle with is um, I have to think sometimes that there's a design to nature and life. I just don't think whatever intelligence created life and the planets and the stars really gives two hoots about what we do with our lives.
Yeah. The way I look at
Um,
it is, there's whatever's going on, whatever simulation we're in, I bow down to whoever programmed it or whatever has responsibility for it. But what I do
yeah,
realize is the more I learn, the more I know there's so much we don't know, if you know what I'm
yeah,
trying to say.
yeah. There's a lot. There's a lot, and so I don't pretend to have the answers. I just know that religion does not make any, you know, for me, organized religion makes no sense.
And I don't want you to blaspheme because people will
No,
start.
no,
So let,
no.
no, you remember the term in Jamaica, they use the term, and if your mother
I,
heard you say something that she didn't like, you probably got to bed without dinner. So,
I totally understand that.
yeah, yeah. Do you want to be cremated or buried?
Cremated.
Cremated.
Well, I have two options: cremated or my body donated to science.
Okay, cool.
Mm.
Nice, nice, nice. And do you think your high school had a lot to shape who you are today? Man in school.
Yeah, I mean, I was a pretty reserved child in high school, very reserved and shy. Um,
What got you out of the shell? Because you're talking to Roger on his podcast, and you can't be shy, 'cause we're gonna talk.
that's a very good question. That's a very good question. I don't know that I got past that um, easily. I think it probably happened after well into my postgraduate training, to be honest, where you were forced to defend yourself and your opinions, your
Right, right.
medical opinions, and you had to speak. And Jamaica can be a harsh society,
Right.
and the medical training um, is no different, right? Guys get on you when you can't defend your treatment choice or your medical opinions, right? So you have to come
And
right.
when you say get on you, you mean they really challenge you and make you
Yeah,
have
yeah,
to hold your corner and
yeah.
show your hand. Yeah, yeah,
Go
yeah.
back to the books.
Right, 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 right. No, no,
Yeah.
no. I understand that.
But I think also it's maybe having kids. Having to try to show them to how to speak up for themselves. Um,
You drink alcohol, Michael?
I do partake.
What do you drink? What's your drink of choice?
Being a Caribbean man, I do like a good rum, but I don't. I'm not one of those real nephew guys who will
White rum? No,
drink
no, no.
white rum and water and that sort of thing.
Right, right,
So
right.
you give me a nice, smooth rum. I like sipping rums.
When was the last time you were nice, real nice, until you stand up and you shake a little bit?
Well, I try not to get there. But that would have been maybe, I don't know, good 9, 10 years ago at a Christmas party, maybe. Yeah,
Okay.
good
So
time
you
ago. So
you
I
you stay on the safe and narrow. You always stay in the
yeah,
cool.
I don't like that feeling at all.
Wow, wow, wow. If you try it a little bit more often, you'll get to it. That feeling would be a nice feeling. You
Because
said to yourself,
the dose response, you need to get to the right spot.
Tell me, Michael, about a difficult time in your life and how you overcame it.
Well, um, unfortunately, you know, I've had a divorce, and that was a very difficult time. Uh, how I overcame that probably, I don't know. I think time, um, and I think learning to forgive myself for the mistakes, you know, along the way. Um, still
Is there is
trying.
there is there a reason why a man would want to blame himself for his mistakes? I mean, things happen and we move on, but or is this you taking personal accountability?
To, yeah, I think we all, as men, need to take accountability for our actions. So, um,
But men will be men, yes.
yeah, and I mean, I don't necessarily regret the decision. I just regret the way I handled myself around that time and some of the choices I made.
So how did you
So,
get yourself mentally out of that situation, considering you didn't go to a pastor, make him pray for you and to want to pray the thing
mm,
away? So how did you manage?
well, I do have a very few good friends that I'm able to talk to.
4,
Uh,
5, or 10?
much less than that.
3?
Two or three.
And they say that is so important. They say it's so important to have that close bond of people that know you. Go ahead, sorry.
So, sometimes. when you feel like you're the worst human being in the world, you just need that reassurance that you messed up, but you are still valuable, and you need to forgive yourself and move on. But um, yeah, I think having people who you can be vulnerable with is essential. Who you can share your absolutely abysmal times with.
I think being able to talk to people is so therapeutic. I mean, how do you manage your mental health now, Michael?
Well, right. Well, I do. I'm remarried. Um, very recently, actually. It's been what, just like 6 weeks. But having
Congratulations.
right. So working in medicine, and I'm not by any means pretending that medicine is the only stressful job there is. But um, as I get older in medicine, I've been practicing medicine for 27 years now.
Hmm.
Being a surgeon as well, um, you often feel like there's never a time you're not on call because you always feel like you need to be available to your patients. Um, it's sometimes very difficult to turn that off. Um, and the knowledge that another human being is putting their well being in your hands, the weight of that responsibility is always somewhere, at the back of my mind.
Michael, if you could do me a favor, you said the weight of that being in this position where you're needed all the time. But when women marry you, they know this. This is a guy that's on call. No, yes.
Right. But so I'm not talking about the my partner's
Okay.
knowledge of because she's also a physician.
Okay. Okay.
But this is the stress of having that responsibility, that personal stress. Um, so managing that is one of the challenges that I face. Um, I think the way I do that, obviously, I don't necessarily, and I'm not a social animal necessarily, but having quiet talks with my partner helps a lot. Just sort of decompressing. Um, I go to the gym. That helps because at the gym your focus is trying to get through a very challenging workout, and your mind, you don't have any thought, or you're not dwelling on those things that typically bother you. Um, yeah, I think having people around you helps a lot. Um, yeah, so I do try to decompress when I can. Um, I don't do as many extracurricular things as I would like. Um, I do like to travel, but again, I don't get a lot of opportunities to do that these days.
So if you got 3 weeks or 2 weeks vacation right now, where would you go?
You know, being out of Jamaica, uh, I would have to go back home.
And where would you go? Back in Delftland? Where would you go specifically?
Yeah, I think, I would visit my mom
Okay.
for a while, and then I'd probably spend a little time on the North Coast
Nice, nice.
or Portland. I love Portland. Yeah.
Okay. I've never been there. Never been there. Okay.
Oh, yeah, Portland is nice, man. It's a little different from the North Coast Negril kind of tourist product, which is
Hmm.
a bit more sort of commercialized. Portland is nice and laid back, and it's just a nice feeling. It's a different sort of scenery. It's nice.
What would you go back to if you had the opportunity to go back to your 18-year-old self, what would you say to him?
Hmm. You know, I just lacked a lot of confidence, um, and I wasn't one of these driven teenagers. I think I would like to be a little more focused on my academics at that age and confidence. I think, when I look back, right, I loved cricket, I loved basketball, I loved I love sports in general, and I would do relatively well, but never really apply myself. So all of those things, I think I would like to do a little more, do a little better, and you try to get your kids to sort of not make the same mistakes, and you expose them to things, and you try to push them, and it doesn't work.
Right,
you
right,
know,
right.
they'll do what they want to do. But yeah, that I would do that. I would be a little bit more outgoing, less reserved, enjoy life a little more, because I think I was very reserved, and but I think what that allowed me to do though is sit back and sort of observe the world, and maybe if I was a little more outgoing, confident, you may not be as observant, and you may not be. So I guess I am where I'm supposed to be,
So
and
you're just in the cut, catching, watching, seeing everything with
yeah.
wisdom.
Well, I'm hoping I've acquired a little wisdom as I've aged. Um,
Are you hopeful when you think of the future?
um, that I think we have progressed a lot as a species, technologically. I think we've become very individualistic, though, um, and I think we somehow seem to value the pursuit of individual happiness above everything else. And I don't think that makes for good society building. And I think it's eventually going to become a problem, um, where the pursuit of individual goals and happiness becomes, such a central aspect of each person's life that they
You
forget
sound
that.
like a comrade, you know.
I don't know. I think if you don't have a little bit of socialist leaning, something might not be right with you.
Yeah. You have to think
uh,
of the collective, us.
right.
Can't be me,
And
me, me, me.
right, because at some point, the breakdown of that social cohesion affects everybody.
Um,
I think that's where I'm missing.
When you die, what do you think happens to you?
I think your body decomposes, and that's it. You go back to the earth from whence we purport to have come.
Okay, okay.
But yeah, I don't like. I think people say they're spiritual.
Hmm.
I don't know if I describe myself like that. I do think there's more to a person than their physical presence,
Hmm.
but I don't believe that your spirit outlives your body. If
Okay. No, no, good answer. I mean, I feel as though we go back to the place that we were before we got here, and that was nowhere, you know.
yeah,
So,
you're
so
right.
we're on the same line here. But when I didn't, I'm just letting you know that there are other people that think the way that you do, you know.
Yeah,
So, what advice would you give a 50-year-old, 60-year-old going up person to allow them, and this is my last question, to allow them to have great sex and great pipe work health?
right. So, a lot of the damage we do to our body starts really early, really early. Um, so when you're in your teens and early 20s, you feel you can eat anything, but these things, do have a cumulative effect on you as you age. So, I think, they say in Japan, these kids don't eat. At school, their school meals consist of broccoli and boiled rice and a little fish or something like that, right? And the average age of a Japanese now is like 85, 86. Um, that's life expectancy. Sorry, I should say. Um, so there's obviously something we're not doing right. I do think we probably need to adjust our diet. We in Jamaica we consume too many carbs, too many fried foods, too many. I know I love ackee and salvage myself, but I love a fried dumpling. But the truth is, that's probably not the best kind of diet to have, right?
Right, right, right.
Starting early, eating well, avoiding the excessive drinking and smoking, um, and exercising, activity. Or if I think we do ourselves such a disservice by not showing our children examples of activity, having healthy activity. Um, One of my pet peeves is patients will come to me and tell me, "Oh, but doc, I walk around at work all day, but your heart rate don't go past 80, so
Right.
it doesn't matter.
Yeah,
You
yeah,
need,
yeah.
it's better than sitting down.
Uh huh.
You can't really qualify it as exercise. So you need to do something that kind of gets your heart rate up there. You break a little sweat, and no, you don't need to be doing marathons or lifting 500 pounds and bench pressing 300 pounds. It's just you know something you can manage that challenges your physiology a little.
Nice.
So I think if you do those things as men, you're likely to you're likely to maintain your potency as you get older. Um, and with the urinary issues, you may not have any control over that because you can do your best with your diet, avoiding a lot of the pitfalls, but heredity does play a big role. So there's some things you have control over and some things you don't.
Wow.
Uh,
You know, Dr. Brooks, I'm really, really happy that you took the time to spend and entertain me because I always knew this was going to be fun because I believe there's a lot of questions we have, and there's still going to be questions because I believe we do bury our heads in the sand. We tell too much lie, and we won't admit when things are staring us in the face. So I'm really glad that we were able to have this kind of conversation, and I hope to have you on again. So thank you for blessing this forum, sir.
Most welcome, man. I'm happy to be here. Happy I could have contributed. Hopefully, you know, some people took away something positive and some information, some useful information from the talk. I certainly had a great time.
Good, good, good. Thank you very much, sir, and have a great rest of the evening. Okay.
You too, Roger. Take care, man.